Eric Bakker, the naturopath. Thank you for looking at my video. If you're not new to this channel, please have a look at the playlist because there are a lot of videos on this channel. There's over 2,000. It's a lot. So we've been working on this channel now for a long time, several years, and there's an expanded range of topics. What I've been doing the last several months is answering basically FAQs, or frequently asked questions. So I get many questions from people, and I've got a team of people that work with me, and they pick out probably about 8 or 10 of the best, well, not the best, but topics of interest or ones that get regularly asked, and then I'll answer those, make a reply to them. And that's what I'm doing today. So here's an interesting question I got from somebody. What do I try first if I'm not sure if I have Candida, leaky gut, or SIBO? What do I try to make sure I don't get it all wrong? That is, do I need to do a Candida diet? Do I need to do a liver detox? I get confused on the order, and most doctors won't test for Candida. My liver numbers are normal on blood tests, but I have symptoms of it needing to be cleaned. It all gets very confusing. So this is a very interesting topic, and many people are confused. In fact, it's not just the patients that are confused. Most doctors are confused. Most medical doctors haven't got a flippin' clue about functional digestive problems. I'm not saying they're incompetent. They're extremely competent. In fact, they're too competent, meaning that they're so good at treating diseases that they forget how to treat functional problems. They forget that people actually develop problems before they get sick. Okay, it's the get sick stage where doctors treat, not at this stage here. This is the stage I treat. I also treat that, but I prefer to be working with people before they get really sick. Okay, so, and of course, as you know, the best time to stop anything from getting worse or really bad is to get onto something right at the very beginning. And these beginning stages are the confusing stages. These are the times when people haven't got a clue what they've got. These are the times when doctors don't know really what they're dealing with most people. So they'll send a patient home with a diet sheet or a pill of some sort, and that's it. There's no investigations really. So you don't always need to do a stool test right up front. Most people who get really sick, okay, from a functional perspective, let's just say Candida or SIBO, they start off with some type of problem. And as I mentioned in many previous videos, something caused it. All right, there's always a cause. Something made it happen. So it's up to you to find out what you did that made you go off track, or what caused your gut to play up like that. So this is what I would recommend that you do in the early stages if you don't really know what you're dealing with. You need to sit down and have a good, long, hard think and look at your lifestyle and at your diet. Okay, those are the two key things that are primarily under your control. We can't control the weather. We can't control the politicians that are off the rails at the moment. We can't control a lot of things. Okay, a lot of people would like to control global warming, but they can't, because it's something that the planet's responsible for, not just for one person. All right, so it's pretty hard sometimes to control things that are beyond your control. But your diet is totally in your control. Okay, you decide what you want to eat, and there's so much information I've spoken about on this channel regarding what to eat that I shouldn't have to really go over what's good or bad in this video. If you need to really know what's good food to eat, go and have a look at some of my diet videos, because there are plenty of those. All right, so the thing you do up front is you need to look at what you're eating. Okay, that's the first thing in your control, but also how you're living, how you're sleeping, many other things, what you're taking, and also what are your thoughts and the kind of problems that you've got. Are you a person who suffers from high anxiety? In that case, you may have a minor problem that could be blown up out of proportion. All right, so do you do a test up front? Do you see a doctor up front? What do you do? That depends on the symptoms, how bad they are. All right, but I can tell you this, a very clever thing to do is to try and really in your mind work out what made you go off track in the first place. And often that's a good indication for you on what you can do to hopefully remedy it, or that will give you a couple of good pointers. So if you took an antibiotic, for example, you'll likely know that there's a big chance you've messed up your gut because of that drug. But you could be taking a drug right now every day for weeks or months on end, and that could be causing problems too. So you can probably hear what I'm saying here. If you are taking medications, you need to see a healthcare professional. naturopathic physician or medical physician and talk to them about that medication. Okay, because from where I'm sitting, one of the key things I've seen many people get sick from are pharmaceutical medications, just as much as I've seen people get sick from drinking Diet Cokes all the time or eating Kentucky Fried Chicken all the time or crap like that, right? Oftentimes a person will be actually thinking that they're doing the right thing, but they're not, they're doing the wrong thing, right? So that's a key thing. If you're on meds, you know, you need to see someone. If your diet is off track, you need to get that sorted. If your lifestyle's off track, you need to get that sorted too. There's no point reaching for supplements, you know, or spirulina thick shakes, you know, if you're living in a really, really crappy area and you've got a lot of social problems. You're probably really wasting your time, you know, trying to really do something extreme in that situation. An extreme thing to do would be to get out of that situation. Now, I lived in a situation like that in my 20s. Okay, I had no money and I was quite poor, and I lived in a shocking situation, but I got myself out of that situation. And, you know, many people can do the same thing, right? So, my liver numbers are normal on blood tests, but I have symptoms of it, okay? Many people get confused. They see LFT, liver function test, okay? They'll see 3 or 4 enzymes in a normal range. Well, that means squat, okay? It doesn't mean that you don't need a detox just because your liver numbers are in the normal range, all right? Most people benefit from a liver detox. And if you look at Candida Crusher, the first thing I recommend with liver detox, obviously, is to stop drinking alcohol and to start looking and doing things, you know, from the opposite perspective, is the bitter foods, things that people don't like to do. So changes need to be made, right? So with the liver issue, I want a liver detox. I wouldn't even jump right into that. I would certainly go and get some professional help and find out what's going on, all right? What kind of lifestyle you've had that led you into wanting to get this kind of liver detox, for example. So if you're confused, don't be confused. Your body doesn't know what signs and symptoms are. Okay, it doesn't name diseases. We give names to diseases. By trying honestly to correct your lifestyle and diet yourself at home initially, all right, that may really make a massive difference. And in some cases, all the difference you need to get back on track. But professional help is always well worth seeking out. So my recommendations are to see a naturopathic physician regarding those 2 key points, diet and lifestyle. And then if you've corrected those or made changes and you still keep cruising down the path of symptoms and problems, then look at some functional tests. That could be a stool test, it could be a urine test, it could be a blood test. There are various tests you could do. I prefer functional tests over pathological tests, over disease tests. Because remember, we're dealing with people who are beginning to get sick in those stages. They're not actually seriously sick yet. Right? That's where functional testing is perfect. So don't be confused. There should be no confusion. Try those things first. If it's still not working, go and see someone and get the testing done. Thanks for tuning in.